Okay, now we're going to look at part 2 of the topic back pain in horse riders. We're going to look at treatment and rehab in this. So just a quick revision. We've looked at structures, cause and effect, and postures. And what we're going to discuss now is treating back pain, products for back pain, exercises, rehab, and when to return to riding. But I'd like to also discuss what not to do for back pain. So that'll be interesting for you when we get to that little slide. Now, treatment for back pain. Now, we've been through the assessment, and your assessment has given you a diagnosis. There's lots of treatments available for back pain, and this is an individual thing, but we need to look at the time for healing, and again, education. You certainly need to rest to allow healing, to allow repair. We then go to rehab. We restore normal movement, we restore function, and then we manage. And by manage, I have a line, manage or treat no pain. And a lot of people don't quite understand that until they get there. So education is absolutely the essential key to understanding the injury and the outcome. You must know what you're dealing with, because if you don't understand the mechanisms of your injury, you're not going to respect your treatment and your rehab. And if you re-injure, you've just got to start again. So the initial aim for treatment, and treatment, this is just treatment, not long-term rehab, is to reduce the pain and set your body up to allow it to heal in the best possible posture. And certainly there's a lot of things available. Medication is important, and this is where working with your doctor as a team approach works. The amount of rest and the style of rest is important. I prefer heat over ice. There's a lot of people that won't use heat on the back and they only use ice. And I'll straight up tell you, neither is wrong and neither is right. Try heat if it works, try ice if that works. Heat tends to reduce spasm. Ice tends to work on the sensory nerve endings to reduce pain. Certainly once your injury's gone from acute, I always recommend heat. Massage, see a good educated massage therapist. Mobilisation, that comes under the umbrella of physio. Chiro adjustments, it's not necessarily something that I recommend, but a chiro makes a good chiro, I don't. So if that works for you, certainly use it. A chiro is a good chiro and a physio is a good physio. We do interrelate, but I'm a physio, so I use physio. Acupuncture is purely for pain, evidence-based that it does work, and like every treatment, it doesn't work on every person. And if you go to 10 different practitioners, often you'll have 10 techniques. So I use acupuncture for spasm, for pain, and for muscle balancing. Get very good results, but it's not guaranteed. Now, people with acute back pain, I often recommend a back brace. I prescribe it and fit it and teach people how to use it. There are people out there that say if you use a back brace, you're going to be hooked on it. Garbage. If you know how to use it, it comes back to the education. We start with early intervention exercises. Now, if you are in kind of the really serious end of back pain, spinal injections, not a big fan of these, but again, where they're needed, and but the outcome is often not that great. People need 3 or 4, and the failure rate's high. But certainly if you're looking for that, you need to discuss it with your surgeon and go with his advice. Absolutely every single person who has back pain has to go through a spinal stabilisation program to re-establish normal core movement. Now, if that fails, certainly surgery may be on the table for you. It is a last resort and final. Once you've had surgery, you can't undo it. So they're the treatments. Some of the products that you might be prescribed, as I said, a back brace if your pain's not too bad, and one of the, again, having done the assessment, if your core is one of the problems, the core belt might work for you. TENS unit works for many people. TENS is a little electro unit that works on the muscles and the nerves. the foam roller for soft tissue massage, the spiky ball for soft tissue massage, heat pack ice. Now the TheraBand comes in a little bit later for strength and posture training, as does the weights. Now rigid tape and rock tape can be used, rigid tape for stabilising joints and rock tape for facilitating muscle function. They do have a different use, and again, in the right hands and the right application, certainly a great product for treating and rehabbing back pain. This is new. That's what this blue thing is here. A very good tool for core and stabilisation exercises. It is a high-end tool, not common, but one I use. Gym ball's certainly been around for a long time. This is just a little pink. The pink thing here is to do stretches on. That's a headache tool. And here I've got the body blade, and certainly all gym equipment. So these are the products that are used for treating, rehabbing, managing, restoring back pain. Now coming back to what I do, certainly a complete assessment as we've gone through in part 1, and looking at cause, effect and cause. We look at people's pain tolerance, what they do, and we come up with a starting point. But the first priority is certainly pain. Pain control is absolutely a must. People can't function with pain, even if they've got a high pain tolerance. It changes them in many, many ways. So education, again, like I said before, when we mention disc pain, people seem to think it's the end of their lives. It's not. It's just an injury that we have a great deal of understanding now on how to treat and manage. You need to have a look at advice and taking of pain meds, but particularly this is non-steroidal anti-inflammatory drugs, Nurofen, Voltaren, and there's many on the market. Certainly discuss it with your doctor and or your chemist. They play a huge role in the early management of pain management. Massage starts to release the muscle tension. Joint mobilisation can readjust the alignment. Heat, certainly what I prefer, and as I said before, acupuncture, and we start to look at correcting postures. So the first 1 to 3 weeks, my treatment involves these sort of things in various combinations, all or not any, or in the combination. Whether we use a back brace is a one-on-one decision, and whether I tape people. So the priority is muscle spasm, and like here we've got a list. Here we've got extreme muscle spasm. Now muscle spasm is not a cause of back pain, it is an effect of back pain, but if it remains untreated, it becomes a cause of other problems. So cause and effect, as I said, we go around in circles with that. We look at the non-weight bearing movements so that we can take the pressure off the disc. Correct alignment, very important. You don't want to be sitting like this. You don't want to be sitting like this. This all comes back to the education of exactly what is happening at the structural level of your disc. Look at sleeping postures. Now, one of the most important pieces of advice I give people, usually on their first treatment, is how to cough and sneeze. Now, you might go, well, what's that got to do with things? When we cough, we bend forward. By now, you should be understanding any prolonged or loading through bending is going to increase the disc pain, which if you've already got a disc injury and you cough and pound away at it, you're going to cause a further damage. So I always say to people, cough into the air. Not very elegant and maybe not very appropriate. Cover your mouth, obviously, but cough with your back straight like this and cough into the air. That will help protect further injury. Now, walking is important. Now, people say they can't walk. Start with 10 minutes at a time. And if you've got proper pain control, and again, with a correct assessment, this is not, go out and do it, but this is part of what we start with once we've got the process in place. So early treatment, early advice, don't sit around slumped like this. You can use your TENS unit on various parts of your body. Now, Mackenzie's postures are quite famous with all physios, unloading the spine, non-weight bearing, bending backwards. I don't like the head going back, but the bending backwards is the part of this. Wearing a back brace, laying flat, a little bit of bridging, and some press-ups. Maintaining your neutral spine as you start to move, and keep that curve through your lower back. So do not sit like this. It is not good for your back. So having gone through some early treatment, moving on to exercises for your back. This is generic. I advise you to consult a physio, or if you've already got education in place, you can follow some of this. Now, the early intervention exercises are really important to settle pain and to support structures. If you start stretching the structures that have been damaged, you're going to cause more pain. So if you're going to start stretching and pushing on joints, again, this comes back to the assessment. Might feel good, but it doesn't necessarily is good. The absolute first priority is the core crunch movement pattern, and I'll go through that in detail because it is really important that you leave this little seminar being able to do that. We then move on to progressive functional core movement training. I'll explain that in more detail. Walking, and when you walk, I want you to march. So you swing through your arms with a straight back rather than swinging through your elbows. And when you do this, you'll understand that. If you swing through your shoulders and not through your elbows, and you march with a deliberate walking action, you will bring in your core naturally. Floor exercise, the proper stretches, resting postures to allow structures to settle. Pool exercises, these are non-weight bearing. If you go into the pool early in your the early intervention, don't do too much. You can't do harm, but you can certainly hurt. Because when we get in the pool, we feel quite good and we're free of gravity to a point, and we start moving, and you can certainly overdo it. Absolutely correct posturing at all times. Now, these are all early interventions, but they do follow through for the rest of your life. We progress these early interventions with care into a long-term functional movement training, and then functional or long-term management of no pain. So some of these exercises are going to be generic and some of them are going to be specific. The one that I do, you can do this and you can listen quite intently with this and follow on, is the core crunch. Now, very many people say to me, I shouldn't be doing any core or ab exercises in the first week. The core muscle doesn't move any part of our body, and the function of the core muscle is to stabilise our spine. So I don't understand why you wouldn't introduce the pattern of the core crunch day one. It does no harm, it does do good, it does take an effort, but the thing about the core muscle that is something that, if you remember nothing, is remember this, that is when you have pain, the core will not work. So if you can bring the core back in on demand every single time you know it's dropped out, then you are stabilising your low back. So if you start with the core crunch, it prevents the decay, it stabilises the injured structures, helps control pain. It's the first movement pattern of your rehab, and it's the first functional movement. So how do you do a core crunch? Some of you will know this and some of you will find this fascinating and be grateful that you're going to learn it. So the core, we want to isolate the core to engage it. Now remember that the core, or if you don't know this, the core does not work on its own, but I want you to engage it on its own so later on you can make sure that it is working in the group that it's meant to be working. So you can sit with your legs. If you're sitting just on a normal chair now, go to the edge of the chair, spread your legs, spread them quite wide and sit up tall, okay? Sit on your seat bones, sit upright and stretch your head away from your seat. Not erect, but upright. Put your hands on your hips. Now, without taking a deep breath, you're going to blow, and you're going to blow like you're blowing through a straw. Now, before you do that, the reason that I get people to blow when we start talking about drawing your core or your belly button in, many people suck. They sort of suck their belly up under their ribs. Now that's your diaphragm. We're going to inhibit that movement. So what I want you to do is gently blow without taking a deep breath, and I want you to keep blowing as if you're blowing through a straw, long, slow and continuous until you run out of breath, but I want you to feel what's happening around your lower belly. And what you should feel is that you've got a tightening through your stomach, through your back, but you shouldn't have any movement. Now, if you can't do it on the chair sitting, here's another position that just demonstrating. No core, core engaged. The back doesn't move, the body doesn't move. We've isolated the core on demand, inhibiting the breathing with no movement. So to do a core crunch, you're going to have a straight back, you're going to blow, you're going to draw your belly button in, you're going to hold it, and then you're going to let it go. So you can repeat this movement pattern, but I want you to focus on the tummy. Now already I can hear some, oh, but this is not functional. You're certainly right, it's not. But if you don't know how to engage your core on demand by inhibiting your breathing is going to take over and you won't be able to isolate the core. So the movement pattern is you're going to blow, this stops you sucking, you're going to engage your core muscle and you're going to feel it. Then you're going, that's the first part of the exercise. As we move through rehabilitation, you will certainly learn to use your core no matter what position you're in and no matter whether you're breathing in or out or holding your breath. That is functional core movement training. At this stage, I want you to be able to engage your core on demand as you blow, not as you suck. So the early intervention resting postures to engage the core crunch, you're going to use various postures because we don't want to just train in the one, because if you train in the one, you're not learning function, okay? So laying flat on your back with a small lumbar support, on your tummy, sitting with a lumbar support, and I've got some pictures of this, sleeping with pillows, and walking using your arms and lifting your pelvis. So here's some of those postures. You can lay with the support through here, through there, and through your legs. This allows your back to relax. You can do the core crunch in that position. You can wear a lumbar support just for sitting. You can do the core crunch in that position. You can do the core crunch in this position. You will find it very difficult in these two positions. Later on, as your pain settles down, I would hope that you can core crunch to bring yourself out of these positions. Laying your back with support, again, just looking at the various positions. It's important to keep the lumbar spine in neutral and avoid flexion to minimise pain and to set you up for the best structural alignment so that you can then use your core to support your spine as you move through a healing, restore and repair and rehab. Now, your core crunch is going to be one of the single most important movement patterns, and tune in here very clearly for returning to riding and when you are riding. So having a look at some of the resting postures, we want to unload the spine. You can do this as a movement pattern. If you work at a desk, just simply by unloading, by putting a leg on one step. Again, these are not, you don't stay a long time in these postures. Just going through the deliberate marching, walking through, swinging through your arms, not through your elbows. So this is correct, this is not. And lying on your belly, that unloads the disc the most. Now, some of the early intervention exercises. Now that you know how to core crunch, you're going to do that for every single one of these exercises. These are early intervention pain and returning to symmetry and unloading the disc. When I talked about stretching, this is stretching the muscles, not stretching the joints, although we do have some stretching. So gentle rotation, non-weight bearing. A little bit of back extension through prone and through bridging. Pelvic tilt, you can do this in all positions. A really important one to start early because it certainly engages the core, but we get coordination through the lower abs and through the lower back. Single leg lifts, you don't start this until you've got absolute core control, and certainly go through some testing before you start this. So this is a bit of a generic training. Don't do this exercise until you can hold properly through your core. This is a straight leg raised nerve movement exercise. It's one that I give every person with back pain, not because every back pain has a nerve impingement, but because it can prevent as well as it can treat. And certainly all of these are done with your core support. Now, when we move on to rehab, the aim is to stabilise more so than pain control. We must stabilise and restore the correct movement and the correct alignment. So we want the correct postures. This is where education comes in, the correct stretches. If you've got loose joint structures, you don't want to be doing a lot of stretching. You want to be doing more stabilising. Now, this would have come up in as flagged in your assessment. So I keep going back to the assessment. This is a generic presentation. Make sure that you apply your assessment to some of the education and advice I'm giving here. Every single one of you will do functional core stabilised movement patterns. So you might do certain Pilates exercises, certain gym programs. All of it will involve core stabilisation, and it will have a function. Exercises and function are two different patterns. The function of some exercise is to strengthen, and the function of some movements is, for instance, being able to sit, stand properly. We want to build strength, endurance and symmetry. Now, returning you to riding is a little bit more detailed than returning you just for your work. We want to build cardio fitness. That's just important for all people. Now, coming back to the specifications of the movements for riding, when I rehab my people with back pain, I add in the rider-specific movement patterns, and I will show you some of those in detail early so that we can achieve them with core support. If you go to the gym, you need to be very careful with, again, the progress, and again, coming back to the correct assessment and information that you get along the way. There are some gym machines that I would never use, and I will show you those. The pull, the OOV and the body blade certainly have a great role in teaching, training and stabilising the spine. So once you've been through exercises, we build the progressive core movement training. So we might add in more detailed core or stronger core exercises, specifically for balance, sit to stand with a stabilised back, and I'll go through this. Many people sit to stand with a bent back. We increase the floor exercises and looking at the combinations of how you move your legs and your arms away from each other with core loading. Now we can load the core up with weights on the limbs. Now we can do that fairly heavy quickly because we are non-weight bearing. We are also in a position where the back is flat and not flexed. So there's a difference in loading non-weight bearing as opposed to weight bearing. So don't transfer one position, a floor exercise, to a standing exercise without understanding it. Now, specific for horse riding, we want to do the isometric posture work. Now, isometric posture work is being able to sit, like if you're sitting, listening to this, sit up straight and see if you can keep that posture for the next 10 or 15 minutes. That's the training that is isometric, specific for horse riding. You can use an exercise bike for cardio, swimming certainly good, treadmill in the marching action, cross trainer. This is quite exciting if you add in with your eyes closed. Again, do little bits before you become, have a fall. because it is quite interesting how when we take our eyes away and we start doing cross work, how uncoordinated we can be. But that's a skill that we need for riding. So that is an exercise that you can use. You want to do ball work with the pelvic tilt, strengthen your abs, balancing on the ball, using weights again for independent isolated arm, hand and foot movements. The TheraBand has its role. And now this statement, walk like a dork, not like a duck. When we were looking at flexible flat feet, if you walk with your toes a bit like a duck, you're going to micro-traumatize many structures and end up with back pain. So if that's how you walk, now walk like a dork means start walking with your toes turned in. It's not as easy as it sounds. And again, I go through a whole process to get to this rather than just a blatant statement doing it. So if we have a look at some of the loading we can do to strengthen your core, again, you have to have information on how to progress this slowly. We can do leg extensions, that's good for the glutes. We can do pelvic tilts in all fours. We can do it in lying, and we can do it in side lying, and certainly doing it in standing. So the time frame will vary for each person. This is just a pure Pilates exercise, very, very good for functional core stabilisation. Here's a similar exercise, being able to take your hands away from your feet in a predetermined pattern. Like here we've got a diagonal pattern. Practice this, it's actually quite, it's much more difficult than you think it is. Plan to take your, in this case she's taken her right hand away from her left foot, bring them back together. You will find that your hands will follow. And again, this is transferred to your riding. If you don't want your hands to follow your feet, train them, and this is one of the exercises that you can do. Here's just a stretch, unloading the back and working with the adductor muscles in rotation of the hips. So these are specific for loading the core. Now, some of the riding patterns that I talk about, again, these are exercises that people can do that are not horse riders because they are excellent for back pain. But when we start training specific functional core movement for riding, we want to be able to have core stability and be able to have strength, direction and isolation through, you know, both hands at the same time, independent of each other and independent of direction. So being able to get one hand up and maintain this stable structure, a stable posture, the same with standing on one leg, being able to stand up from sitting and maintaining this upright posture. These are movement patterns that I've designed specific for riding. And these are just a few examples. There's quite a lot of detail that goes into this. Being able to move your pelvis deliberately sideways and in circles and in forwards and backwards, anterior and posterior tilt, with your legs apart, with your legs together and with your hands in different position is a skill that you need to train specific for riding and to stabilise your low back. Here's some more. Here we've got a stretch for rotation of the hip in neutral pelvis with a core hold. So knees together and ankles apart, and that will give you some stretching through your hip. This is using the oove. Now, if your core is not strong, you'll just topple off the oove and being able to maintain that hold and then move the limbs while balancing on the core is really quite a high-end stability exercise. And the ability to move your hands and your feet in predetermined patterns is a functional exercise that we apply to train you with that skill to be able to do it when you are riding. Here, if you're standing on one leg, we call this triple flexion, being able to maintain core, neutral pelvis, because it's neutral pelvis here, and this upper limb posture. Again, we want to be able to maintain this for more than a few seconds, at the same time maintaining the lower leg. So this is the static posture because we're not moving yet, but we want to be able to maintain that posture when the horse starts moving and then when we want to start moving the horse. So I call this the triple flexion movement pattern. Sit to rise on the ball. One of the most common problems is the lower leg swinging. So if you learn to squeeze the ball as you rise, you're going to learn to maintain the stability of your lower leg in the rising trot. This is a really valuable exercise. Now people go, you don't do that. You actually do that, but maybe not with the power that you're going to do it with here. It's the pattern that we're training, not quite the specific, because of course that's not a horse. Now I call this the woodpecker, being able to strengthen your hips. This is much more relevant to people who are learning how to use their lower leg in the saddle or jump riders. This is one of the movements that I use for learner riders so that they get the idea how to stabilise and what muscles are needed to be strong, and again in symmetry. So we've got core hold, we have got neutral pelvis, we've got flexed hips. The control of the flexion here is coming through the buttock and the hamstrings, the knees remaining stable and the foot is remaining stable. So the only movement in this, call it the woodpecker, is flexion and extension of the hips. So the trunk comes closer and then moves away. So you need to see this in a video, but this is a really important, these are the three most important exercises I give for riders to practice out of the saddle. Now I'm just going to go through some safe stretches. We certainly want our hamstrings to be long. Do not stretch, and I'll show you a few in a minute, do not stretch with a bent back. This is a muscle stretch, more so for the upper limb. In a flat spine, we are rotating it, but the muscles are stretching here. We've got a calf stretch here. This is the 2-joint calf stretch, so it's stretching with a straight leg. This is the 1 joint, so it's stretching with a bent leg. You do need to have instruction on how to do these because, again, the alignment needs to be correct. You want your toe, your ankle and your knee to be in the same alignment, not with your foot out that way and your knee this way. This is a rotator stretch for the hip. Basically turn your toes in with your legs straight. This is a stretch for the hip flexor. As much as the picture looks easy, you do need to set this up correctly, and possibly you need some instruction on how to do that. This is for the glutes and the hips, and it's always nice to have your animals helping out. As I said before, coughing and sneezing, always do it into the air and not downwards. This is a stretch for the adductor, and the reason these two stretches are quite, you can do these, is that we've got a straight back. Now with all of these muscle stretches, you can hold them for up to 2 or 3 minutes if you can. Certainly if they're causing pain, you need to have someone help you out. So this is generic safe stretches. Most of them are very, they're not a problem at all, even if you haven't had an assessment, but certainly make sure that assessment is in the back of your mind. Continuing on, if you want to stretch your hamstrings and stay non-weight bearing, the couch and the wall is always a good, we've got a good position. You have a good stretch here, and you can just move closer to the couch, which makes your leg more vertical. No stress on the lumbar spine. Stretching the calf muscle without a wall, making sure that your back has got a bend backwards or certainly not a bend forwards. Adductor stretch here, I wouldn't reach into this one. You can do a little bit of lateral bending, certainly not forward bending, but this position alone is quite good for stretching the adductors and the hips. Here's the psoas one again in more detail. This is a good one for both the limbs, both your shoulders and for the upper back. You can see here with the ribs coming up, the back's going to be arched. So when I talked about right from the very beginning, the big shoulder muscle, the lat dorsi that affects the back, this is the muscle that you're stretching there. So if the shoulders are not moving correctly, then it will affect the back. This one's 100%. Everybody should do this regularly, whether you've got back pain or not. You just support your knee, bend it and straighten it, bend it and straighten. Do it slowly and controlled. That's a nerve root movement. This is an unloading of the disc. It's called extension in standing. Pretty obvious. You extend through the low back. You don't just arch the upper back. And this is just a passive stretch for the calf because if you think about where we want our lower leg, we want our heel lower than our toes, so we need a longer calf muscle. Now, riding is one of the very few sports that needs a longer calf muscle, and we need an inhibited push-off. So that is specific for riding. Again, having a look at some of the things that you can do, working in correct alignment in all of these exercises. We've been through this one before. You must be able to be symmetrical in and maintain the transfer through the core and not let it all collapse out. So this one, simply standing on one leg, is a very easy exercise, gives you a lot of information. Sidestepping works the butt and the lateral side muscles. Very good early intervention exercise. This is more high end with the body blade, and again, you need explanation on that. Standing and starting to move around, very good for endurance and for correct alignment. This is just the beginning of a balanced workout, so these are all incremental exercises. You can do all of these in the early and in the later stages. This is more high end, and the reason we can do this one, if you look again, the back has got a curve inwards, not outwards. So this is the most important thing. Now, I've batted away on what to do. I see it all the time, what people are doing, and you know, you go onto YouTube, 10 best hamstring stretches. Yes, they are very good, but they're very high risk for injuring your back. Now, I make a blanket statement, never do any of these. There are better ones that you can do that are low risk. Yes, rowing is fantastic for cardiovascular, very good for many of your muscles, but look what it does to your spine. And if you understand or remember that we talked about repetitive micro injury, you spend half an hour on the rowing machine going from bent, pulling into extension, you are loading your disc up over and over and over again. Yes, you might end up with fantastic muscles. It is a symmetrical exercise, but more than likely, and I see it many, many times, injuring your disc on the rowing machine. Here, just too much flexion. If you did it laying down, much better. So lay on your back and do it. Same with this, all bent spine, lifting with the bent spine, bending and twisting. Okay, the spine might be neutral, but it often doesn't stay that way. So here you're grinding the disc, pushing it into, fixing the pelvis and then grinding it into a rotation. High risk. High risk when you use both your arms and your legs at the same time. This is a high-end exercise. I often say to people, don't do this one ever, or unless you are under instruction and you know that your core is coming in. This guy's obviously handling it. Here's a common stretch. Don't do it. It is a good one, but it's risking injury for your disc. And here we go again with the bent spine. So any stretches that you are doing, this one would be fine if she stood upright. This one would be fine if he laid on his back. This one would be fine if she laid on her back. Same with this one. Do not bend and stretch in any position under a load. You may get away with it, but remember I said it's the many micros. So, having gone through some treatment, some early intervention, some rehab, and some specific rider movement patterns, when do you return to riding? Now, coming back to understanding, you must understand what the mechanisms, and remember jarring is one of the most common causes of back pain. When you go riding, you're going to start jarring. So you need to know, you can return when you've got some pain, but you need to know how you're going to control that jarring, and we'll certainly go through that. If you've got nerve pain or you're still getting significant disc pain, if you've got numbness, pins and needles, then don't return to riding with any of those symptoms present. These are long-term permanent risk or risk of permanent injury. So don't risk it. It's not worth it. If you've got a little bit of back pain and you know how to maintain good posture, you can return to riding. If you have muscle imbalances and you've been stretching out the tight structures, and these again have all been discovered in your assessment, you can start riding and start to change start altering those habits of those muscles becoming more tight or more weak. So your riding can be therapy. If you've got joint pain and stiffness and you're doing the correct exercise, you can still return to riding, but again, always comes back to the understanding. If you're unfit with your endurance, unfit and your cardiovascular training is ongoing, you can again start, but you don't want to be going to do too much. And certainly you should have started the rider's specific movement patterns for riding, because these are setting you up to be successful when you do go back to riding. Now, it's really important that you ask somebody else to lift your saddle and do the heavy work, because remember, we keep going back to cause. It's the micro lifting that will reduce the resilience or injure your disc if it's already under pressure. So riding can improve your rehab or progress your rehab if you do it right. So what we're going to do now is go to part 3, and I'm going to give you some riding tips on how you can return to riding with your back pain. Again, if you've got any questions, send them through. So I hope so far, you're learning something and you're going to be able to apply this information to your own lifestyle. So thank you for your time, and we'll talk about returning to riding now when we go to part 3.